Hello, everyone, and welcome to our presentation on Bridges to Access B2A. My name is Alice Moon. I'm a second-year medical student in the Bridges to Access chair.
My name is Brandon Moritz. I'm a third-year medical student at the University of Oklahoma College of Medicine, and I'm the president of the OU Community Health Alliance and also a graduate research assistant on campus.
Today, we're going to be talking about B2A, which is a student-led interdisciplinary educational conference for health students. Bridges to Access was founded 15 years ago as an initiative of the OU Community Health Alliance by OU College of Medicine students. Its central mission is to foster meaningful conversation and identify vital solutions to the most pressing issues of healthcare. It has a particular focus on issues that affect medically underserved communities and populations. On the slide, you can see a photo from a past conference, and this year our conference looked a little bit different since it was delivered virtually during the COVID surge. This is a picture of what it looked a little bit more like. Our conference was spread over 2 days on February 11th and 12th of this year and was organized by medical students and public health students at OU-HSC and OU Tulsa. Our target audience are pre-health and health professional students. And our theme this year was health and climate, looking at the health effects of climate change. On this slide, you see a quote from an editorial of over 200 medical journals stating that the greatest threat to global public health is the continued failure of world leaders to keep the global temperature rise below 1.5 degrees Celsius. Urgent society-wide changes must be made and will lead to a fairer and healthier world. Our conference addressed the different health effects of climate change and also highlighted the fact that the health effects of climate change will especially affect vulnerable populations such as those who have lower resources, who have existing health conditions, and who are from minority populations. Our goals of the conference were to educate attendees to understand the broad health effects of climate change, to understand the health disparities exacerbated by climate change, and to engage with students and speakers from different health and environmental disciplines. To do this, our conference programming included 3 keynote speaker sessions, the first by Dr. Robert Haley, who discussed the causative factors of climate change, the second by Dr. Elena Kraft, who discussed climate injustice, and the third by Dr. Lisa Doggett, who discussed patient advocacy. We had 14 different breakout sessions divided into 3 different breakout session segments. On this slide, you can see all of our breakout session speakers and their affiliation or credentials and the topics that they discussed. We had researchers, physicians, public health leaders, attorneys, people from EcoAmerica, from the American Cancer Society, and the Consortium on Climate and Health, and discussing different topics related to our theme. We had 550 people register for our conference, and we had 350 people attend our conference. Out of the 7 colleges located on the OU-HSC campus, we had 6 attend the conference and participate. On the slide, you can see the breakdown of the attendees. Brandon will speak to this later, but we organized our conference in an interdisciplinary framework so that we could attract all of these students and expose them to all of these different perspectives. We created a climate of mutual respect and shared values, and on the right of the slide, you can see some of the ways that we did this. To assess our conference, we developed a 21-item Qualtrics survey to see the success of the conference. It measures knowledge understanding, beliefs, self-efficacy, and confidence, and we invited attendees to complete the survey before and after the conference. We used a paired t-test to evaluate the statistical significance of the changes between their responses. I'll pass it on to Brandon now.
Thanks, Alice. So you can see on this slide that we had 177 students respond to the pre and post survey, and the breakdown of those students that responded resembled the exact demographics that we also had for those that attended the conference. And on the slide, we have a number of different results. All of the 21-item Qualtrics survey questions all proved to be statistically significant from the pre to post survey outcomes. And on this slide, we really have a nice look at two different question types, one of which was understanding and knowledge, and the other one was self-efficacy and teaching someone else about the content. We had significant changes in all of them, but one thing I want to point out is that the largest changes between pre and post survey outcomes was on Q2, Q9, and then Q11, all above 1.5, and all of which are question items that were about teaching someone else about the content. And then on this slide, we have continuation of the statistically significant outcomes from the pre and post survey analysis. And on this one, we have some teaching questions, some understanding, but for the most part, these are belief questions about how urgent it is to know about the effects of climate change. Does it require an interdisciplinary solution to combat it? So I want to point out Q20 as having a significant outcome, and it was a belief that we were particularly interested in, of the question, I am concerned about the effects of climate change on health. And then we evaluate it with a Likert scale of strongly disagree to strongly agree. Another thing to point out here is that we also had 3 items that had negative changes. And so see Q15, Q18, and Q19 all had negative changes from a pre to post survey standpoint. And we really think that's because some of the content that we shared at the conference actually, we think, broadened the understanding of the attendees' perspective on this topic, and what they previously thought they had a handle on. For example, for Q15, to what extent do you feel prepared to handle the health effects of climate change? Well, once you learn about all the vastness that climate change has in regards to its effects on health, then it might be a little bit overwhelming and daunting to tackle. And I also want to speak to some of the specific IP competencies that our conference addressed. And so moving into that, I want to kind of highlight that, just like Alice said before, we had a very large emphasis on having an interdisciplinary conference, knowing that climate change and health and the intersection of them both, it requires an interdisciplinary model to provide a solution. And we also saw that 92% of respondents believed that their experience at B2A was enhanced by hearing from individuals from disciplines that weren't their own. And then we also, in that interdisciplinary model, had a big emphasis on not only bringing in the knowledge and expertise from our own roles, responsibilities, and discipline, but also being able to accurately understand what other individuals and other disciplines bring to the table as we co-collaborate on trying to address this issue in society. And so we had a bunch of different voices at the conference, not only amongst the attendees, but amongst the speakers. And we think that this was really a good melting pot to try to have some of that collaboration and mutual understanding as we look towards the future and what to do. And then in addition to that, a sub-theme at the conference was just communicating about this information and this topic. And so from all the workshops and the sessions and the plenary speakers to also group discussions and also more informal discussions happening between sessions, we think that there was a lot of really great interprofessional communication and also kind of in a way that could not only allow practice for, but then equip students to then communicate with community members and patients in the future. One thing I want to highlight is that we had a session that was specifically targeted towards communication skills. And while it can be a polarizing and controversial topic, it was a really educating and enriching experience to be in a session geared towards the communication side of it. And then also anyone that attended that session was able to have an opportunity to practice in a small group setting to kind of refine and test those skills out that they had just learned. And then some future work that we're hoping to do for the conference is we're hoping to just better engage students from all the colleges on the OU-HSC campus. And then we're also trying to formalize some of the learning objectives that we tackle and address at the conference in hopes that it will better inform OU-HSC curricula and potentially be integrated into the overall curriculum on campus. And then in addition, we have a great show out every year from OU-HSC campus students and also OU and Norman campus students. But we also want to try to bring in students from non-OU institutions so that we can have a greater diversity in opinions and expertise in an interdisciplinary setting that the conference provides. And here's a slide to sum up some of the key metrics from our conference. We had a number of attendees. We had a great response rate to the surveys, and then we're able to find some pretty relevant findings from the survey analysis. And all in all, Bridges Access 2022 was a really successful educational interdisciplinary conference that really focused on one of the most pressing issues in society today of the intersection of climate change and health. And we're really looking forward to what future conferences will address and how we can work together to solve some of the most pressing issues in society. Thank you very much for your time and appreciate you listening.